So, hi ladies, how are you doing today?
Doing good.
Great. Is everything going well here in the imaging department?
Everything's going great, thank you.
Great. Happy to have you guys here today, taking great care of our patients. Thank you.
You're welcome.
So I'm Dr. Stuart Menakar here at the Palo Alto Medical Foundation, Los Gatos Center. Thanks for joining me today on Health Connections on KCAT Television, Los Gatos, Montessorino. On today's episode, I'm going to have a nice chat with my good colleague, Dr. Alan Su. He's from our Department of Podiatry. That means feet and ankle care. Dr. Su, Alan, good to see you today.
Hi, Stuart. How are you doing? Thanks for having me today.
Let's head this way and we'll have a seat and start a chat.
Great.
After you. So, Alan, tell me and our viewers, if you would please, what's a podiatrist?
So a podiatrist is actually a physician that specializes in foot and ankle problems and pathologies. And we have provided numerous type of techniques and treatments to help with these injuries or pain that people experience in their foot and ankle.
So, healthy feet make for healthy lives.
This is very true, Stuart. The feet and ankle are people's livelihood. Everyone is working and on their feet quite a bit. And so if there's any kind of injury or any type of pain associated with the foot, it definitely hinders their activity and their ability to undergo their work life or even their job in a sense. So that's why the podiatrist is actually very important, I think, to a lot of people because, again, their feet are their livelihood or their life in a sense.
What kinds of troubles are most common in your office?
So the most common type of pain or pathologies or issues with the foot is, one is heel pain, two is bunions, three is kind of ankle sprains or ankle injuries. And then again, there's a number of different other type of issues that we treat here at Palo Alto Medical Foundation in the podiatry. But those are one of the three main type of issues we see with the foot and ankle.
So all of those problems you've mentioned, Alan, are things that I see as a family doctor in my clinic. How should our patients decide whether or not to see their primary care doctor about foot problems or come to see you in the podiatry office?
So I think one of the important factors with patients going in to see their primary care physician is they typically come to their primary care physician for just an overall checkup. And the primary care physician does a good job in providing treatments for the foot and ankle initially. But again, if the initial treatment really is not as effective or the patient is still having pain, I think that's a good indication for the primary care physician to go ahead and refer the patient to podiatry, to the specialist, so we can use our kind of specialized knowledge with the foot and ankle to further provide treatments for the patient.
Well, as a primary care doctor, I know that there are an awful lot of things that we as individuals do that impact our feet, and that there are some things that we can do at home, both in choices of footwear and other things that can help prevent the need to come see me in the family practice office or to see you in podiatry. So let's back up a little bit and talk about what patients can do before they need to see a doctor to help make sure they have healthy, happy feet.
So basically what patients can do at home in order to prevent any type of foot issues or foot problems from occurring. One is that good supportive shoes are very important for the patients. Getting a shoe that has good structural support will provide additional support to the arch, to the heel, as well as help people sustain their activity much longer. The other is that basically getting a good stretching regimen. If the person is very active, that's also very important regarding stretching some of the muscles associated with the tendons or the ligaments in the foot will help to prevent any additional injury in the future. The other is just limitations regarding your activity. Obviously, you don't want to do too much too quickly. Early kind of treatments for patients if they are having some generalized foot pain, again, is icing, stretching. People can also consider anti-inflammatory medications to really treat these kind of issues or conditions before they see the primary care physician or get referred to a podiatrist.
So one thing I hear you saying is that choice of shoes makes a big difference. One of our colleagues once said to me that if everybody had got rid of their flip-flops and sandals and all women stopped wearing high heels, that 80% of podiatrists would be out of business.
Well, let me clarify that. That's a great generalized knowledge of shoe selection, and basically sandals as well as heels typically are shoes that you should avoid. Okay, so that is somewhat accurate in a sense because flip-flops provide very little support, but again, for people that, let's say, have wider feet or people that have areas of rubbing, a flip-flop actually, in that sense, is not a bad idea because closed-toed shoes for certain patients will rub up on areas of pain, or if they, let's say they have a callus or a corn in the area, sometimes we do recommend some open-toed shoes for them to prevent that kind of, I guess, frictional force from occurring. High heels is definitely something we deal with every day with patients. High-heeled shoes are not necessarily a poor selection for certain patients. For patients that actually have no pain associated with the feet, high-heeled shoes are fine. The one concern that we have with high-heeled shoes with patients is it does elevate the heel significantly. And sometimes what that does is that your Achilles tendon, which is one of the strongest tendons in the body, is kind of on the back of the ankle. And when you wear high-heeled shoes a lot, sometimes that causes contractions of the Achilles tendon, and that can cause some inflammation of the Achilles, which means it causes some discomfort. But this doesn't happen all the time, but one of the concerns for high heels. The other issue with high heels is that when you elevate your heel, you put a lot of pressure on the front of the foot. And so for some patients, if they have issues at the front of the foot, let's say they have a corn or they have pain, this can aggravate the issue. So they really need something that's not going to elevate the heel and put a lot of pressure on the front of the foot.
Another thing I heard you say besides shoe selection is to be a little bit careful about changes in activity levels. Sounds like if we try to do too much too fast, we're more likely to have injuries or pain.
This is true. So a lot of patients are these weekend warrior type of patients, and they all of a sudden want to skateboard or play basketball when they haven't had any of those experiences in the past 10 to 15 years, which is fine. You have to be mindful about the activity. A lot of the injuries that occur that we see in our clinic from these patients that just try to do too much too quickly. But we definitely recommend exercise and people being active because that leads to a healthy lifestyle.
I know that a lot of my patients talk about podiatrists as a place to go to get their toenails clipped or to take care of calluses or corns or something like that on their foot. But you've been talking a lot more about pain and injuries and those sorts of things. What's the difference between what I hear sometimes about people's ideas with podiatrists and what you do here at the Palo Alto Medical Foundation?
So with us at the Palo Alto Medical Foundation with podiatry, I think we provide a much larger range of treatments for patients. Of course, again, the generalized kind of consensus is that podiatrists just trim nails and calluses. But now I think there's been a movement, especially with the podiatrists at Palo Alto Medical Foundation. We're not just podiatrists that provide conservative care, we also are actually surgically trained. And so all of us are trained in various types of surgeries dealing with all the foot and ankle issues or pain. So we deal with fractured bones in the ankle and the foot. We deal with a lot of different kind of aspects of the foot and ankle regarding tendons and ligaments. And we deal with a lot of sports injuries as well as traumatic injuries. So the Podiatry Palo Alto Medical Foundation, we deal with basically everything involved with the foot and ankle, not just conservative care, but also a lot of us have been well trained in our residencies and fellowships just with even traumatic injuries, treating them either conservatively or surgically.
So many of the simple things like minor sprains, pain in the heel or the arch, corns and calluses, things like that I see every day. One of the most common things that I end up asking for your help with would be for my patients who have plantar fasciitis or lots of pain on the sole of the foot and in the heel. Help us understand a little bit, Alan, if you would, about why people get that kind of pain and what are some things they can do at home or that you would recommend doing to help prevent troubles with plantar fasciitis.
So plantar fasciitis is generalized or equals to heel pain. And so I would say a majority of the people that enter my clinic come in with heel pain. And so just a quick definition of plantar fasciitis, which actually is inflammation of the plantar fascia, which actually is a band at the bottom of the foot that attaches from the heels to the balls of the feet. And the plantar fascia is more of a kind of a structure that stabilizes the foot that helps with walking and running. But with the plantar fascia, it actually is a very important mechanical tool. It, again, is a band that helps with propulsion in a sense. So when you're actually pushing off with the motion of running as well as jumping. The issue with the plantar fascia is actually a very thick band. So what happens is that if you have very tight muscles or tendons or ligaments in the foot, it can put a lot of stress or tension to the plantar fascia. And the plantar fascia at the insertion of the heel is actually very thick. It's actually where the plantar fascia connects to the heel and it actually spreads out toward the balls of the feet, almost like fingers. So the larger or more thicker portion is at the heel. So what happens is that your musculature, especially if, let's say, your calf muscle or the Achilles tendon is very tight, that puts a lot of tension on the plantar fascia and it gets inflamed relatively quickly. And so that typically is what plantar fascia is. It's inflammation of the plantar fascia at the bottom of the foot. Treatment-wise for this, what you can do to kind of help with these issues, there's actually quite a bit conservative that you can do at home yourself. One is that because of the tightness of the musculature in the foot and ankle, stretching actually is very, very important for this type of issue. So with the plantar fascia, it's actually a fascial layer. So you typically can't stretch out the fascia, but it actually works in concert with the calf muscle. So stretching out the calf muscle actually helps to alleviate the tension to the plantar fascia, relieving the inflammation. So doing kind of calf stretches, getting a band and wrapping it around your toes and pull it towards you will help to alleviate some of that tension and alleviate the inflammation. Icing, anti-inflammatories also are some good treatments for plantar fasciitis. One of the things that's actually particularly important is actually massage. So physical massage has been shown to help alleviate inflammation to the plantar fascia. So massaging the heel with your finger, or even getting a tennis ball or a golf ball and rolling it around the heel. Even some of my patients will freeze a water bottle and roll it along the heel. And that typically has been shown, even in literature with research, to decrease the inflammation to the plantar fascia and help out with the pain.
One thing I didn't hear you talk about was arch supports. I watch television, and there are all these great commercials about gelling to help out with my heel pain. What do you think?
So gelling actually with Dr. Scholl's is one of the big kind of companies that are pushing gelling, because they're gelling basically. I'm sure everyone has seen the commercials. So it's been shown actually that with plantar fasciitis, it is that band at the bottom of the foot that realistically gets inflamed from stretching or kind of tension on the bottom of the foot. So when we think about that with the plantar fascia, you want something more structurally supportive in order to prevent that tension from occurring. So gel inserts will typically feel good initially because it feels like you're walking on pillows, basically. But when we think about treatment, we want this to be more long-term. We want this to sustain through the entire activity, as well as your sports or your hiking or your everyday activities. So my recommendations typically would be more of a structural supportive insert. So an insert that's really not going to be very flimsy, it's not going to bend, and it's going to provide support for the arch. Because the majority of the people, their arches will collapse when they're walking, and that really puts tension on the plantar fascia. So you want something that's going to prevent that arch from collapsing and put less tension on the plantar fascia, as opposed to a more gel insert that's just going to provide cushion but no structural support.
So if I can summarize briefly, Alan, I hear you saying that good shoes, good arch support, ice, massage, and not doing too much too fast when you're starting a new activity are the best ways to help reduce heel pain and pain in the arch of the foot. Is that about right?
This is correct, yes.
Great. So the next thing I want to ask about regarding the heel and the arch is heel spurs. Is that really the problem?
And a lot of my patients come into clinic saying, oh, I have a heel spur, we need to get rid of it. And so I have to kind of go through the whole process with them. So heel spurs for plantar fasciitis has been shown not to be the problem why they're having the heel pain. What happens is that where the plantar fascia is under so much tension that it actually pulls on the heel bone, causing the heel spur to form. And the body is a miraculous thing. So the fact is the bone is elongated from the heel so that the plantar fascia actually has to cover less distance. And so it actually helps to alleviate some of the tension. But the fact is the heel spur itself is not really causing the heel pain. There's been studies that have looked at this, and it's been shown that they've looked at 1,000 patients diagnosed with plantar fasciitis, and not all of them had heel spurs. So in a sense, the information is very valuable to us because it shows that the plantar fascia inflammatory process is from the plantar fascia, not from the heel spur.
So once a patient's done all the smart things at home, gotten the right shoes, all those things we discussed, seen their primary care doctor, had lots of good advice, but still has trouble with heel pain or arch pain, and they come to see you. What sorts of other options do you have besides what we've already discussed?
There's actually a lot of different still treatments and techniques. One is that it is an inflammatory process. So one of the things that we offer for patients is actually a cortisone injection in the area. And what the cortisone does, as everyone knows, is an anti-inflammatory type of medication. So it's an injection that we inject in the area that will decrease the inflammation for the patients. The other thing that we can recommend is that if the patient has been doing stretchings, but it's only been kind of occasional, they've been kind of on and off, I stretched at dinner time maybe yesterday and today possibly. One of the things that I like to recommend to patients sometimes is to kind of jumpstart that compliance with stretching, and that's sending the patient to physical therapy. Because a physical therapist is someone that has a very specialized kind of knowledge of stretching and also anti-inflammatory type of techniques. The other thing that we offer at Palo Alto Medical Foundation that is specialized again is actually custom inserts or custom orthotics. Everyone well knows that you can go to a store and buy an insert, but it's typically, again, not custom for your foot. I really equate it to kind of prescription glasses. Prescription glasses are something that are specialized for your specific kind of eyes. And so custom inserts have the advantage of actually being custom for your feet. And so they conform to the foot better, they provide arch support that is specifically for your foot type, and provide better support. They also last longer because they are made of more durable material than the over-the-counter inserts. And then from that point in time, we can actually discuss further imaging as well. X-rays, again, will really not focus on the plantar fascia because it will only show more of the bones in the foot. If there has been a patient with chronic plantar fasciitis, which has been ongoing for a long period of time, we would consider getting an MRI for the patient, which would actually help us to visualize what the plantar fascia actually looks like on the patient, again, as opposed to just a regular X-ray.
You mentioned your top problems for your office, and one of them was bunions. Mm-hmm. What causes a bunion?
There's a lot of different theories with bunions. People think that it is inherited, and there is actually a genetic component associated with bunions. A lot of researchers and a lot of articles do state that the bunion is inherited from down the family line. I see a lot of patients where they have bunions, their mother has bunions, their grandmother has bunions, and so it's something that is very common within the family. There is also, according to theory, a mechanical, again, it's just a mechanical type of component associated with bunions. So basically, when a patient is walking, they're putting a lot of pressure kind of on the middle of the foot. So this could cause the bunion to form or to cause a progression of the bunion to get worse. And so those are kind of the two main reasons why people typically get bunions.
What do you do about it?
There is more of the conservative route versus even surgery for bunions. So conservative route is something that you can do at home, or you can consult, again, your physician. But one of the things that we recommend for patients is, one, wider shoes. So as I mentioned when we talked earlier about sandals, it's actually, or open-toed shoes, it's actually something that's very beneficial for patients with bunions. Because the fact is, for a closed-toed shoe that's very narrow, it's going to rub up on the area in which you have your bunion, which is on the middle of the foot. So a wider shoe, an open-toed shoe, is one of the treatments that we could recommend. The other is inserts or good supportive shoes. Inserts and supportive shoes will definitely help to prevent the bunion from getting worse because you are alleviating the pressure to the area in which you have the bunion. The other kind of treatments that we could recommend are bunion splints or bunion guards, really just to help decrease the pressure to the area.
So you mentioned surgery for bunions. One thing that, as a primary care doctor here at the Palo Alto Medical Foundation, I appreciate an awful lot about our podiatrists who do surgery is there are some foot problems that just don't respond otherwise. Bunions can be one. There's obviously conservative treatment and comfort measures, but also things like hammertoes, where the toes are contracted and they don't ever straighten out properly. They cause a lot of rubbing and pain. If you would tell us a little bit more about some of the common surgeries you do that are necessary when the primary care doctor doesn't have any other tricks to help out.
There's a wide variety of different procedures that the podiatrists at Palo Alto Medical Foundation offer. And one is surgery for bunions. So that involves actually something to correct the position of the bone in the foot so that the patient itself will not have this large prominence that causes them pain. And we typically will pursue surgical intervention or procedures for patients when they have pain basically every day, with walking, with even at rest. The other type of procedures that we offer are to reduce the hammertoes, which are basically an imbalance between the muscles and tendons of the foot causing contracture of the toes in the foot. We offer hammertoe surgery to correct the contractures because those contractures rub up on the top of the shoe causing pain. The other type of procedures that we also offer are within the foot and ankle, are any type of issue with pressure on certain areas, pressure underneath the feet, pressure on the side of the feet. There's different type of surgeries to kind of offload the pressure or cause pain for the patients with the foot as well as the ankle. For the ankle issues, there's a lot of issues with the ankle of all ages. One is sports injuries as well as just kind of wear and tear. So a lot of sports injuries are involved with the ligaments involved with the ankle. A lot of ankle sprains, a lot of people, again, as I mentioned, doing too much too quickly. And so there's a lot of different ankle surgeries that can help to either repair the ligaments or even to help decrease inflammation in the ankle. And then also one of the big pathologies or issues that we deal with that is surgical, as I mentioned, is traumatic injuries. And so that's something that the podiatrists here can perform. If there are any broken bones in the foot or broken bones in the ankle, we do offer surgery to help fix those if they are needed.
I think a lot of our patients don't really understand that about podiatrists. Here at the Palo Alto Medical Foundation, almost all of our ankle care for surgeries, fractures, and other related problems goes to the podiatrist.
Right. Mm-hmm.
We haven't talked about ingrown toenails yet. I'm sure that's one of your favorite things to take care of.
It is, definitely. So ingrown toenails, Stuart, thank you for bringing that up, are something we see every day. And it actually affects people of all ages. We see patients very young, all the way to patients, a lot older that are very active that get ingrown toenails. And so ingrown toenails are actually an increase in pressure to the toenail that causes pain because the toenail pushes into the skin around where the border of the nail presides and causes pain. And it can even cause an infection because it makes a break in the skin, exposing it to the environment in a sense. And so typically for patients with ingrown nails that we see, one of the things that you can do at home initially before you see a physician is actually one, you want to decrease the pressure to the area of pain. So again, open-toed shoes or shoes that have a little bit more flex or larger toe box in the area. The other thing, if there is inflammation associated with the ingrown toenail, is to soak the foot, actually. And what we recommend is you soak it in warm water, and you can use some Epsom salt, which you can get at your local drugstore. If you are diabetic, obviously you need to consult the podiatrist or your primary care for some of these treatments because there are some obvious issues or concerns with diabetics. So that's something that you should consult your primary care physician for, or the podiatrist. For soaking in warm water and Epsom salt, this helps to decrease the inflammation associated with the nail and also softens up the nail. So this sometimes will help to alleviate the symptoms for the patient and actually alleviate the pain. But if there is an instance where the patient is having a lot of pain, there's an infection, they've done soaking, but typically it's not resolving the issue, then they definitely need to come in to see their primary care or podiatrist. And the treatments that we can offer at this point in time actually is to do a procedure where we remove the border of the nail or the offending border that causes the pain. And this is something we do very routinely. A patient can walk right afterwards, and it provides a lot of relief for the patients, and they're very happy.
You mentioned diabetics need to talk to their primary care doctor or the podiatrist before using some treatments. But I know that for diabetics, many folks have special needs with regard to their feet or special problems with regard to the feet in folks with diabetes. Could you explain a little bit about that, please?
Sure. So with diabetes, the patients that we see, and we see quite a bit of diabetics, just because there is some issues with people with diabetes that can affect their feet. Basically with diabetes, they can start getting numbness and tingling in the feet. So, and also can have possible some, decrease in blood flow to the feet as well. So it is recommended for patients with diabetes to see a podiatrist on a routine basis. The reason why this is so that we can kind of check, again, as I mentioned, the sensation of the feet, check their blood flow, because they can make the issues with the feet and with diabetes, it can put people at risk for other issues, basically infection or injury or even, ulcers or wounds with the foot. So seeing a podiatrist or your primary care physician is actually very important for people with diabetes to see your physician on a regular basis.
I want to make sure that our viewers understand that foot problems in diabetics are common and something we have to watch out for. But the days of seeing lots of patients with bad sores, ulcers, and losing toes are not so common anymore. There are excellent treatments for diabetes, and as long as you, with diabetes, take good care of yourself, eat right, take your medicine, and have regular follow-up with your primary care doctor or see the podiatrist, we can prevent almost all serious foot problems. It seems like a lot of our patients have troubles with pain when they have very flat feet. Mm-hmm. Why is that?
So let me go ahead and tell you a little bit about flat feet and what I see in my clinic, Stuart. The other day I had a patient come in, a very young patient that was very active. involved in a lot of sports, basketball as well as volleyball. And so these patients come in with a lot of pain in the arch. They also can deal with, when they're running, have shin splints, as well as having just their legs get tired, in a sense. And so a lot of these patients come in because they've been trying to undergo their sports, but they haven't been able to do it very routinely, or they just been getting very tired. And what we do is we go over with the patient kind of what their symptoms are, and we kind of have them walk back and forth. And if the patient does show signs of flat feet, I kind of go into more specifics. You know, flat feet is something that's genetic. It's actually inherited. It's kind of the cards you were dealt with, in a sense. And so I tell the patient it's not their fault. This is something that, you know, their foot architecture and how they've developed. And so with flat feet itself, it's something that is very common. When the patient is walking, their arches collapse, in a sense, and flatten out. And with the decrease in amount of structural support for the patients, causes them pain. And what happens is their body and ligaments and muscles are kind of working overtime. And so that causes pain in the arch and sometimes in the shins, as I mentioned, and even in the heel. And so with flat feet, typically what we do for these patients is we try to provide more support for the arch. And that is through inserts, and supportive shoes is kind of the first type of conservative care that we provide. One of the other issues with patients is sometimes they come in with flat feet, but they don't have any pain. And so with these patients, it's very easy for us, but again, for the patients, they're concerned. And so what we typically do for these patients is we actually just have them undergo just general supportive shoes, because it's been shown, especially in young individuals, if you try to put or force the patients to wear arch supports when they have no pain, it actually can introduce pain. And so initially what we'll do with patients with flat feet is recommend arch supports and inserts. And if that doesn't really work with over-the-counter inserts or arch supports, we go ahead and recommend the custom inserts that I talked about, kind of more of the prescription inserts. And with Palo Alto Medical Foundation, the process has actually become much more efficient with this. We actually use a scanner that uses a laser to actually scan the foot instead of using plaster. The plaster process has been something that we've all been trained with as a podiatrist that provides a good kind of mold of the foot, but it's very messy and takes a long time because you have to have the patient sit there, and it takes about 20 minutes each foot. Now, thankfully, with technology, we have the patient sitting there and we put them in the best kind of position possible, and we use the scanner, and it basically takes about 3 to 5 seconds a foot. And we've actually made the process more efficient in the sense that now we're even emailing the prescription and the scan to a lab that we work with, and then they generate or produce the orthotics, and it comes back much quicker, and the patients are more happy because they don't have plaster on the bottom of their foot, and they're not cleaning and showering afterwards, and their visit is much more efficient that way because it doesn't take as long, and they're much happier.
Sounds pretty nice.
Yeah, it's very nice for the patients and for us.
So 3D printing for arch supports.
Yeah, it's the future for sure.
When we talked a little bit about plantar fasciitis, you mentioned that a lot of stretching of the Achilles tendon and of the calf muscle is important. But I know that some patients actually get significant pain and swelling in the Achilles tendon itself. How do we address it? What's it called, and how do we address that?
The tension at the Achilles is very similar to the plantar fascia. So if patients have kind of tension in the Achilles tendon, which is one of the most powerful tendons in the foot and ankle and even the body, if that gets under a lot of tension, it's actually diagnosed as Achilles tendinitis. And so that equates to just inflammation of the Achilles tendon. Treatment-wise for this, it's very similar to plantar fasciitis, because as I mentioned, it works kind of in concert with the calf muscle as well as with the plantar fascia. So with Achilles tendinitis, because it is an inflammatory process, again, stretching is very important, because the Achilles tendon and the calf muscle actually are the same structure. It's just the calf muscle becomes the Achilles tendon toward the heel or toward the kind of back of the ankle. And so again, stretching out that calf muscle will help to alleviate the tension to the Achilles tendon. And the inflammatory process that causes the pain in the Achilles can be dealt with icing, stretching, anti-inflammatories. Massaging is not as effective, it's been shown, for Achilles tendon as it is to plantar fascia or plantar fasciitis. The other thing that we can treat the Achilles tendinitis with is actually called heel lifts. And what this does, this actually moves the heel or elevates the heel a little bit. So every time you're walking, you Majority of the people, the heel hits the ground first. And when your heel hits the ground, your Achilles tendon is actually contracting. So putting a lift in the heel actually will decrease the distance your heel has to hit the ground. And so that actually puts less tension on the Achilles tendon, alleviating some of the tension, resulting in less inflammation for the Achilles tendon. The other thing with Achilles tendinitis is immobilization, which means putting them into a cast boot or even casting if, in a sense, does not respond well to other treatments that we just talked about. And what that does with patients is it typically just immobilizes it so that the Achilles tendon is not contracting as much and basically alleviates some of the tension or the inflammation.
Do you ever do injections or have to do surgery for tendinitis in the Achilles tendon?
So we do, yes. So one thing about the Achilles tendon is that it definitely responds typically well to conservative care therapy. But then when it is a chronic issue, let's say it's been ongoing for 6+ months, we go to the next step with treatment. So basically with the Achilles tendon, we typically don't do cortisone injections in or around the Achilles tendon. The reason why that is that it's been shown with cortisone injections around the Achilles, it can weaken the Achilles enough so that it can cause a rupture. So that's why with our practice, or at least with my practice, I don't intend to do it because of that risk. Other physicians might, but they might just put a small amount enough so that you decrease the risk of the Achilles rupture. The other type of treatments regarding surgery-wise is that if a patient's had Achilles tendinitis for a long period of time, it becomes this more of tendinosis, which is a fancy word for just kind of chronic issue in a sense. It's what happens is that your Achilles gets very thick because it's weakened, and so your body just makes it more thick to kind of protect it in a sense. So at this point in time, typically what we do for these issues is we get an MRI to really assess to see how the condition of the Achilles tendon is. And at that point in time, if the patient is not responsive to conservative therapy, then we can go ahead and go over the options regarding surgical kind of procedures with the patient, which is a wide variety. Is involved with either removing some of the scar tissue of the tendon or actually making injections within the tendon of certain other type of formulas, or even what we do at certain times is actually poke holes in the tendon. It's called, the fancy word is microdebridement, which is a fancy word. But what that does is that helps to heal the tendon more quickly in a sense. So there is definitely options for conservative therapy, and if those don't work, then we can go ahead and we talk with the patients regarding kind of surgical techniques for them.
Thank you for joining me today on Health Connections on KCAT Television, Los Gatos, Monte Sereno. My guest has been Dr. Alan Su from the Department of Podiatry at the Palo Alto Medical Foundation. And if I may say so, Alan, I think you would say to our viewers, happy feet make happy patients.